Okay, everyone, we're going to be doing vaccines or immunizations today. All right, so immunity. So we have active, acquired, and passive immunity, right? So in active immunity, antibodies produced in the person's body, right? So we have natural. So, you catch a bug, you get sick and your body makes antibodies. Then there's artificial. The pathogen is introduced into the body as a vaccine, right? So if you get a polio vaccine, then your body's still going to make the antibodies, but it's done in an artificial mechanism. You're not actually catching the disease. And then we have passive immunity, which is antibodies from another organism enter the person's body. So we have natural, which is done through like across the placenta or through breast milk. And then we have antibodies are injected through artificial means, anti-tetanus injections, for instance. Okay, so we have types of vaccines. We have inactivated, which is the whole microorganism is destroyed, and but then the dead organism is placed into the body. Attenuated is it's still alive, but it's been modified to be less deadly. Toxoid, inactivated toxic compounds. Subunits, protein component of the microorganism, so part of it, like a surface protein, is injected. Conjugate, so the bacterial outer coats of the organism are injected, so like H. flu, and heterotypic or Jennerian, so pathogens that infect other animals but don't cause disease. Which would be like the Mycobacterium bovis. All right. We have monovalent, meaning it's just a single strain of the microorganism, or multivalent, which immunizes. I'm sorry, this is a British spelling, but immunizes against multiple antigen strains or microorganisms. So multivalent be like something with multiple strains of the flu in it, for instance. So examples of vaccine preventable diseases, there's lots of them out there. You have to be, you're luckily, you're Castle Branch compliant to be in school. But measles, mumps, pertussis, tetanus, typhoid, varicella, okay, lots of things that we can prevent with vaccines nowadays. So childhood immunization. So every year this changes. The CDC, the Centers for Disease Control and Prevention, has recommendations for childhood immunizations. And I'd like you, after class or after watching this, to go to the CDC website and take a look. You're going to be using this site a lot for all patient populations. And then the Immunization Action Coalition has a summary of rules. Again, I'd like you to take a look at that PDF after you're done watching this. All right, so here's the, this is for last year, but the new one I don't believe has changed. And this is the recommended schedule, right? Range of recommended ages for all children is in yellow. And then they have catch-up and ones for high-risk groups. So if you have an immunocompromised child, they may be on a different schedule. But for most kids, and we're going to be dealing with the healthy kids for the purposes of this lecture, we're going to be looking at the ranges of recommended for the yellow ones. So Hep B, the first one on the top, you'll see the first dose is given at birth, and the second dose is given anywhere between 1 and 2 months of age. The third dose is given between the ages of 6 months and 18 months. Okay, so that's the recommendation for a healthy child. Rotavirus, RV1, which is 2 dose, or RV5, which is 3 dose. So first dose, second dose, so 2 months and 4 months for the rotavirus. Let's go down to meningococcal. You'll see there's a footnote. Well, how do I know? You have to read the footnotes for those kinds of things. So this is a multiple page document. Measles, mumps, and rubella for a healthy child. So they're not going to be immune to measles, mumps, or rubella in a regular schedule until 12 months. And then they're not even completely immune until they get the second dose between 4 to 6 years. So if you have someone of childbearing years, a mom who is not rubella immune, realize that the kid isn't going to be rubella immune either. So if the child ends up with rubella and mom's not vaccinated, then if mom gets pregnant again, you can end up with an issue. That's why just be aware that mom is not going to be safe if the child isn't is a 6-month-old, for instance, and catches rubella from preschool. So very, very important, and this is federal law. Anyone receiving a vaccine needs to be given a vaccination information statement, or a VIS. It's federal law. You have to give it. So it must be given to the patient or a guardian. So if you have a child, you're going to give that to their legal guardian prior to vaccination, and they need to read and understand it. It informs the patient and family about the vaccine and common side effects and contraindications to vaccinating. All right. The CDC dates each VIS. So this is a federal publication, and anytime they make changes to it, they put a brand new date at the bottom. So the best practice is to include the date that's on the bottom of the VIS and the documentation after administration, right? So not only are you going to document that you gave the VIS, but you're going to document, the easiest way to document that is to put the date of that's on the VIS. They're available in English and just about any other language. Because it's a federal law, they have to be available in every language. So if you go to the website that's on this slide, the immunize.org/VIS, or you go to the CDC website, they're available in every language. So here's what a sample VIS, this is for the DTaP, the diphtheria, tetanus, and pertussis. And people ask me this, what's the difference between the DTaP and the Tdap? And it's just the DTaP is used for little kids, okay? And then the Tdap is used for adults. And it says, why would you get vaccinated? What does this vaccine, help prevent? Who should get it and when? And risks. So why would you not get this? So if you have someone who with a mild illness, so the kid has a cold, this says you can still get the vaccine. But if you have an allergic reaction to a prior dose, then you probably shouldn't get this dose, right? Older children and adults, it says DTaP is not licensed for adolescents, adults, or children 7 years or older. They get the Tdap, which is similar, but it's just a different formulation. And then what are the risks? So we know from our adult Tdap, or that when we get vaccinated for tetanus, that you're going to have some issues like pain at the site, which is common, right? And we're activating the immune response. That's the whole point. We're trying to get the body to react to what we're shooting into it, so we get antibodies. So we may have a fever, right? Soreness at the site, or redness or swelling. And then other problems. So in a little child, we may have fussiness or tiredness. Okay. What do you do if there's a serious reaction is in here? And then if you get injured from a vaccine, what do you do? And if you notice at the bottom, it says DTaP vaccine. And this VIS, this vaccine information statement, was published on May 17th, 2007. All right. So you would always use the latest version. How do I know if I have the latest version? I'm going to go to the CDC website and make sure I have the latest version. And you can print those right off in whatever language is best for that family. So adult immunizations, again, the Centers for Disease Control and Prevention, the CDC, has a recommendation for adult immunizations. Also the Immunization Action Coalition. And then what do I mean by cocooning? Well, so if we have, for instance, a child, and we know just from that there are certain diseases such as pertussis that child is not going to be vaccinated against until they're a little bit older. The only one we give at birth is hepatitis B. So everything else means that child is not immune. Pertussis is a huge issue in the state of Rhode Island and other places. So if we have an infant, we want to cocoon the infant, meaning if the baby can't be vaccinated against something, we can make sure that everyone else in their life is vaccinated. So all adult caregivers in the family, including grandparents, we would ask them to update their immunizations and make sure that they're immune to things like pertussis as well. That's what cocooning is. So if we can't protect baby directly, we're going to make sure that the environment and everyone that the baby interacts with is as safe as possible. So immunization before foreign travel. So when I teach this class in person, I have everybody pick a place they want to go, and then we go to this cdc.gov/travel, and we look up and see if there's any immunizations that the CDC recommends that you get before going there. And there's some cool places in the world, but not every place, if you're in a jungle or so forth, you could end up getting typhoid or yellow fever. Or rabies, and there are places that you should have that may have a whole list of recommended vaccines prior to going there. So this is my normal fun class activity, is you pick a country and then you select the type of travel and then you look it up. And we've found places where you need lots of immunization before you actually go. So vaccine administration. So we want to do an assessment. Obviously, if the person has received the vaccine already, they shouldn't get it. Do they have any allergies? A common one that may interfere with administration of vaccines is eggs. So if they're allergic to eggs, we would need to make sure that the vaccine that's being administered is not prepared using an egg solution. Medication history, medical history, have they had a prior reaction? Pregnancy, we do not immunize patients, for instance, with the MMR vaccine while they're pregnant. They have to wait. If they're not immune to something such as rubella, then they need to wait until after they deliver. Okay. Vaccination history. So we want to include any prior adverse effects from other vaccinations. We want to assess for acute infections. So if they are acutely ill, like really, really sick, then that may not be the best time to give them a vaccine. So if they have a mild cold, that's usually not a contraindication. Is anyone at home immunocompromised? So there are some vaccines that are given as a live vaccine. So we used to do a lot of the flu mist, which was a live attenuated virus that was done intranasally. If you have someone immunocompromised at home, then you wouldn't want to give that particular vaccine to that person. And then titers for patients unsure of their history. So maybe you lost your vaccine history from your pediatrician and, the place burned down or whatever. We can test to see if you have immunity by checking your titer. Patient education. So nursing diagnosis here would be deficient knowledge. You need to provide the vaccine information statement for each vaccine and answer any questions they have prior to administration. Advise women to avoid pregnancy for 1 month following most vaccinations. Okay. And if you're using live vaccines, advise the patient about staying away from immunocompromised patients. That's really, really important. Nursing interventions. Never mix vaccines together in the same syringe. So unless something is already premixed, like we know that the DTaP already has vaccines against diphtheria, tetanus, and pertussis. That's pre-made and mixed, and it's meant to be administered together. But you'd never mix a DTaP and an influenza vaccine together in the same syringe. One, it's just not good practice. And two, if they have a reaction, we don't know which one they had the reaction to. Okay? So they're going to be administered separately on different sites of the body and with a little spread. Okay? Follow specific storage instructions from the manufacturer. Many of these are kept refrigerated. All right? And you want to follow the manufacturer's administration guidelines. There's an insert with all vaccines. Or check with the pharmacy if you've never administered a vaccine. Some that used to only be given IM are now given subcutaneous, so you want to check the proper route of administration for this. You're going to use a separate site for each vaccine given at the same visit, right? And then we have to document the vaccine given, the site, the manufacturer's name, the lot number and expiration date, and the date of the VIS provided, and the name of the provider who administered the vaccine. So if you look, here's a dose of an MMR, and it says single dose, right, ProQuad, and it says that you store it frozen, negative 58 degrees Fahrenheit, right? So this bad boy is kept frozen until it's administered. And then you'll see on there an expiration date. This one expired already, but you'll see a lot number as well. So all of that information needs to be included on the documentation for administration. So reporting of disease and adverse reactions. So all healthcare providers responsible for all of us are responsible for reporting vaccine preventable diseases. So if you have someone that comes in and they have the mumps, guess what? We have to inform the state of that. Okay, they keep records. Contraindications because there's so many vaccines. If you have a question about a contraindication for a certain vaccine, someone has a special, they have an autoimmune disease, for instance, you would go to the CDC site, cdc.gov, and look up the contraindications for that specific vaccine. And then if there is an adverse reaction, we have to report that. Okay, maybe there's a bad lot, and we have to recall all of that. So you need to make sure that those get reported.